All right, good afternoon, everyone, and welcome. My name is Nehul Vias. I'm a Director of Analytics Consulting and leader of the Tableau Solution Group here at AVAP. We're so very appreciative of the opportunity to present to you all today, and certainly appreciative of your attendance and engagement throughout this session. Before we dig into our topic, I'd like to provide just a quick overview of AVAP and share a little bit about ourselves. AVAP is a cross-platform, industry-specialized global IT advisory and management consulting firm. Our span of consulting and technology resources enable us to build for the future faster and better than before, combining a massive breadth of experienced consultants across several consulting practice areas with the ability to support clients across multiple sectors and industries. Our analytics offerings span the entire data value chain, from organizational data strategy, where we help clients develop a comprehensive roadmap, to their analytics and technology investments, rapid ROI, where the focus is on driving adoption and utilization of an analytics capability across an organization's footprint, and continuous value to focus on sustained and scalable growth. These three pillars are complemented through our ability to execute engagements from robust and transformative solution delivery, supporting enterprise data initiatives, Tableau dashboarding quick starts, Tableau technical health checks with a focus on the infrastructure, setup and configuration of a Tableau environment, and we even serve as a managed services provider to some of our clients to fully host their Tableau capability, accompanied with full service operational SLAs and hands-on maintenance and administration. Before we get into our introductions for our presenters today, I wanted to quickly mention that if you do have a question at any time during the presentation, please do use the QA box at the bottom of your screen or the chat function. We'll make sure to get to your questions in time. This session will also be available on demand within 2 business days of its recording. Now it's my distinct pleasure to welcome 2 of my favorites, Rodolfo Rappel, Solution Architect from our Data and Analytics practice, and CJ Martin, Consultant from our Data and Analytics practice. Gentlemen, welcome. Thank you so much for presenting here today. I know we've got a great topic to discuss. I don't want to belabor the intros anymore. I'm going to hand the ball off to you, Rodolfo. The floor is yours. Thank you so much.
Thank you, Nehu. Hello, everyone. So my name is Rodolfo. I'm a solution architect at the AVAP Advisory Services. I have 25 years of experience in development, consulting, program management, and leadership in data warehouse, BI analytics, data management, and data governance. Before joining AVAP, I spent 8 years as director of IT for a large academic medical center in the Midwest, where I worked on the enterprise data strategy, data governance, and was responsible for the enterprise business intelligence and data warehouse programs. CJ. Okay, our presentation today is about clinically integrating the supply chain and a value analysis use case in healthcare. Even if you don't work in healthcare, you know that the industry has been going through dramatic changes. There are many forces at play driving these changes. One of the main drivers is the unsustainable escalating costs of healthcare, especially in the United States. The US spends nearly twice as much as any other high-income country in the world, and yet it ranks below many of them in health outcomes. Changing demographics, like a growing and aging population with higher incidence of chronic health conditions, are placing new demands for medical services. In response to the raising costs challenge, new regulation and legislation like the Accountable Care Act, as well as payers from both public and private sectors, have taken many steps to provide incentives to shift healthcare providers from the traditional fee-for-service to pay-for-performance or value-based reimbursement models. There is also new competition in the market, with retailers like CVS and Walmart opening clinics and urgent care sites. Patients demand and expect more convenience. They want to use new technology for interacting with their providers, like video visits and telehealth. Staff shortages, especially the shortage of nurses, was already a national serious crisis, and it has now become a critical problem aggravated with the COVID pandemic. And speaking of COVID, it also taught us that we need to make changes to build resilience in healthcare systems to better prepare them for future pandemics. Next slide, please. So in face of all these challenges, what should be the goals of a healthcare system? The industry has widely adopted a framework called the triple aim of healthcare, which was developed by the Institute of Healthcare Improvement. It describes an approach to optimizing health system performance by working at the same time on three dimensions: improving the patient experience of care, which includes outcomes and patient satisfaction, improving the health of populations, and reducing the per capita cost of healthcare. Traditionally, the focus on measuring performance and improving outcomes has been primarily to when the patient needs the care. When care is needed for a broken leg, a heart attack, the patient needs surgery or needs treatment for depression, etc. What's new with the health of populations dimension is that it focuses on addressing questions like, why did the patient have a heart attack, a broken leg? What are the causes of depression? How can these things be avoided? It provides incentives and focuses on transforming healthcare systems to have a bigger impact on helping populations stay healthy. More recently, a newer dimension was added, making it the quadruple aim of healthcare. The industry came to the realization that the stressful work life of healthcare clinicians and staff impacts its ability to achieve the triple aim. And staff experience also needs critical attention. But how do you measure performance of the complex healthcare value delivery process in all these four dimensions? How do you measure patient experience, effectiveness in improving population health? How do you measure the true cost of healthcare? So it's definitely a very complex and difficult problem, no doubt. But a critical part of it is leveraging the data that healthcare is now collecting. And this is an area where great progress has been made. Healthcare systems made huge investments in information technology in the last 10, 15 years, deploying robust clinical and administrative systems like EHR, electronic health record, and ERP integrated packages. And as a consequence, an immense amount of electronic data about patients, disease and health progression, therapeutic protocols, care delivery, and business processes are now being captured. Along with the explosion of transactional health data came a big appetite for secondary use of this data in analytics to create new insights. This is a great opportunity for people with data skills, like many attending this Tableau conference, and for tools like Tableau to be used to help healthcare understand the drivers of cost, quality, and outcomes. Next slide, please. Most healthcare analytics applications and use cases exist somewhere in the business clinical analytics continuum. All these applications are important, but those closer to the extremes are easier to manage because their scope do not cross into as many different business and data domains. For example, financial reporting or profitability analysis on the business left side, consuming business systems data, and patient safety and quality reporting on the clinical right side, consuming data from clinical systems, EHR. Initiatives that involve analytics use cases falling closer to the center of the continuum are harder from a data integration perspective because it requires combining data from a large variety of sources and formats and applying knowledge from a diverse set of domains. If you think about the healthcare triple or quadruple aim, linking clinical and business analytics is a crucial capability to obtain a comprehensive view of health outcomes, patient experience, and costs. One great example in healthcare of the need to converge business and clinical analytics is this concept of the clinically integrated supply chain. Next slide, please. The supply chain function is extremely important for healthcare organizations. Most processes related to delivery of healthcare services are touched by the supply chain. Most people think of supply chain hospitals as inventory management. It is a lot more than that. It's about getting the right product at the point of care at the right time, and to do this seamlessly in a way to avoid slowing down or disrupting clinical workflows. Logistically and operationally, this is very complex. It involves many different stakeholders, and there is a high variety of products that are involved, from simple supplies like exam gloves and syringes to highly sophisticated medical equipment and devices, and items which require special handling and storage like hazardous and biological products and medications. In the example we are using today of knee replacement implants, which is related to what my colleague will show in Tableau, there are now over 150 different knee replacement devices to choose from, with several parts and components configurations that have to match patient level of activity, size, gender, laterality, so on and so forth. So supply chain must work with clinicians to ensure that the right system with all the required parts are available for every scheduled surgical case. An inefficient supply chain can also have a huge impact to the financial bottom line of institutions. Supplies are the second largest expense for hospitals, coming behind only payroll, and it is estimated that it will surpass labor costs soon. Next slide, CJ, please. The clinical integration of supply chain is about the hospital's supply chain function working together with the clinical areas to improve its performance in alignment with the new definition of value in healthcare, which is optimizing for cost, quality, and outcomes. This requires integration of operational processes and systems, collaboration, alignment of decision-making, strong leadership and governance on both sides, and also a sound data and analytics infrastructure to support value analysis. The blue arrow in this slide is a simplistic illustration of the value transformation evolution of healthcare supply chains. At the lowest level of maturity, the focus is on cost control. Purchases are driven by demand, physician preference, and group purchasing contracts. In this level of maturity, there is a lack of standardization in products and processes, and clinician engagement is low. As the supply chain evolves in the maturity curve, at the next level, value analysis is focused on processes improvement via automation and gains in efficiency and cost reduction via standardization of products and reduction of waste. Value analysis committees involving clinical and supply chain leadership starts to form at this stage, but cost reduction is still the primary driver of decisions, and there is limited development of objective non-financial metrics. For the top part of the maturity curve here, that should really be several levels between the middle stage and the top. The evolution path there is a major change, which requires organizational culture shift. At these higher levels of maturity, the organization is achieving a balanced focus on safety, quality, and total cost of care across the patient experience. Purchase decisions are data-driven based on clinical evidence, and this approach is enforced by formal policies. Physician-led value analysis is in place. Vendors are formally engaged to share risk and accountability for outcomes. A strong data and system infrastructure enables automated traceability of processes and products used in patient care. Next slide, please. There are several ways in which clinically integrating the supply chain can provide significant benefits to healthcare providing organizations. And here are just some of the key areas of impact. Value-based purchasing. The first one there is in part due to the lack of price transparency in healthcare. Large variation of price for similar products across different vendors is very common. Value analysis applied to procurement of products looks at lower cost substitute in combination with outcomes measures. For example, a lower cost device or instrument required for a surgery may have negative impacts like extending the duration of the procedure, higher length of stay, carrying a higher risk for post-surgical infection, readmission, or other complications. It's often that higher quality and better outcomes will result in overall lower costs. Next impact area, product and practice variation reduction. Working with clinicians, supply chain analysts, and buyers can standardize certain products. For example, having only one type of exam gloves as opposed to having multiple types. Reducing product variation helps achieve supply chain value drivers by cutting overhead costs related to managing multiple suppliers, orders, storage, and value inventory. Also, economy of scale with one vendor improves the ability to negotiate discounts in large orders. Staff training and education are also improved by product standardization because every clinician learns how to use the same product throughout the hospital. The next three impact areas, prevention of adverse events, impact to workflows, and reduction of waste are related to automation and integration of supply chain and clinical processes and systems to achieve full traceability of products used, matching them to patients and procedures. For example, ensuring that the correct medication for the correct patient is always used by scanning medication barcodes and patient barcode to validate the correct match. Right drug, right dose, right route, right patient, right time, all the time. In another example, tracking inventory, clinicians can be alerted in real time if a product that is expired or recalled is about to be used on a patient. Better inventory visibility also supports practices that reduce waste by prioritizing the use of products that are closest to their expiration date. And this is really huge in healthcare, happens a lot. Improved management of supplies across the system can also have a big impact in staff satisfaction. In many places, nurses spend from 10 to 30% of their time tracking and managing supplies, detracting them from patient care. Next slide, please. So HIMSS has an 8 stages capability maturity model called the CISOM, Clinical Integrated Supply Outcomes Model. I'm not going to spend any time talking about this because there is another session tomorrow at 2:30 p.m. Eastern Time, when two of my colleagues will give a presentation dedicated to the CISOM model. Our company AVAP is certified by HIMSS to help organizations taking the CISOM assessment and assist them with developing a strategic roadmap to guide their journey up the healthcare supply chain maturity curve. If you are interested, please make sure to attend this session tomorrow or contact us for more information. And I think this is a great tool for organizations that are working on a clinical integration of their supply chain. Next slide, please. Lastly, I want to touch on a few critical success factors for the clinical integration transformation program. First, leadership engagement is crucial for success. As a matter of fact, experience from organizations that are doing this shows that value analysis initiatives to replace a product or introduce a new product are more likely to succeed when they are led by physicians instead of by supply chain. Physicians have better big picture view of products and the outcomes that they deliver. This also helps driving accountability for financial performance with the physicians, and also addressing physicians' perception that product decisions are one-sided, cost-driven only. Strong change management is also fundamental. It's important to obtain C-suite support. Senior leaders have the authority and the influence to change the culture and break down organization silos to bring all necessary people together. It's important to educate and broaden the skills of staff. For example, supply chain professionals need to be educated to understand clinical and financial aspects of value-based goals, including reimbursement policies, evidence-based medicine, regulatory constraints, and population health management. And physicians really need to be educated about supply chain operations. They must understand their role in the supply chain process and how they affect outcomes and costs. Data to support the program is very important. A robust, clean, and complete item master is the source of truth for supply chain management. The item master must include universal product classification codes and taxonomies to enable price comparison and substitute product analysis, for example. New metrics are required to establish the link between supplies and outcomes. Data analysts need to explore different data sets and analytical models to understand this correlation. Physicians are often not aware of the cost of materials that they are using. There are no price tags on products in the operating room. They are also often reluctant to change products because of disruption to their existing processes and lack of experience with new products. Therefore, it's important to prepare and present in a physician-friendly format accurate data about product costs and clinical evidence of product performance. Next slide, please. And this is what I had. And so now I'll pass on to my colleague, CJ.
All right, awesome. Thank you, Rodolfo. So let me briefly set the stage for our use case before I jump into our Tableau dashboard demo. So as Rodolfo has discussed, the definition of value in healthcare continues to evolve beyond cost reduction, as factors like patient experience and outcomes need to be weighed and considered more heavily. So to improve end-to-end patient care, hospitals and organizations need to make decisions based on data-driven evidence and move away from these more historical approaches and gut feelings. So I'll be demoing a dashboard that highlights the convergence of business and clinical data domains, including cost, quality, and outcomes. A couple things to note: all the data displayed in this dashboard is not real. It has been mocked up for the sake of this demo. And additionally, in practice, integrating these different systems together and curating automated data sets would be key milestones in order to pursue a comprehensive value-based analysis and ultimately developing a front-end product such as this dashboard. So let's jump over to Tableau. On this first dashboard, we're comparing cost associated with 3 different procedure categories. So as Rodolfo mentioned, knee replacements here in black, gallbladder removals in orange, and shunt replacements in gray. So working our way top down in the dashboard, we have a couple of KPIs displayed at the top, which are indicating average unit costs or the item cost, and then the average case cost or the total cost, which would include elements like labor and overhead. And so the default values displayed currently are respective to the overall averages of the 3 procedure categories that I mentioned. Coming down a little bit further, we have this horizontal stacked bar chart indicating the variance in unit cost of the 3 procedure categories. The larger the section of the bar, indicates a larger cost variance. And then below that, we have a supply cost bar chart, which is taking into consideration volume of the items as well as the cost. And so this is broken out at the surgeon level within each of the 3 procedure categories. For this visualization, we've used table calculations, reference lines, and color at the pain level to indicate high costs. So we can clearly visualize and compare surgeons' supply costs across the scope of procedures or at an individual procedure level. So using Tableau's actions, we can select one of the procedure categories to filter the bar chart, as well as the cost KPIs at the top. To see how the selection compares to the overall average, again, using indicators like color and shape. So we can instantly see that knee replacement procedures have the greatest variance in unit cost, as well as costs that are higher than the overall group average. In the supply cost chart, we can see that for knee replacements, the surgeon's cost, about half of them are above this average line of $7,150. So after reviewing these cost factors, we want to understand if the high costs are actually worthwhile and are driving value. Again, since the knee replacements have the highest cost of our 3 categories, we want to focus our analysis here by examining the outcomes of the products that have been used. So we can select one of the surgeons to navigate to a second dashboard. On this dashboard, we're comparing the cost of products used in the knee replacement procedures. Using a heat map, we can easily see that across the scope of vendors, product 3 is consistently more expensive than the other products. However, just because other products are less costly, this does not mean we should automatically make a switch to the cheaper product. As we've discussed, other factors like outcomes and patient experience matter and need to be considered. So we'll dive a little deeper into the product outcomes. Using some more advanced Tableau visualization techniques, in this case radar charts, we can compare multiple products based on their quality outcomes. So to provide a brief overview of radar charts, these charts display performance of multiple variables or metrics by way of trigonometry. Each variable, in this case, we have 5 quality outcome variables. So for example, length of stay in the radar chart is provided with its own axis that starts from the center, and all axes are arranged radially with equal distances between each other. And then the data points are normalized based on the maximum value of each of these 5 categories, which creates the polygon shape that we see in the chart. So for example, if we had one product selected, we select product 3, and we maintain our selection of our 5 quality outcomes, the radar will default to a pentagon. If we limit the categories, say we deselect 2 of these categories, and now we have 3 selected, the chart adjusts to reflect that number, and now it's represented by a triangle. And so when another product is brought into the view, the chart again adjusts and reorients based on these new maximum values. And so for our scenario, lower values for each of the quality categories indicate a better outcome. So for example, we would want to see lower percent of readmissions and shorter length of stay. That would indicate a better outcome. So to interpret the chart, the smaller the shape, or another way to think of it is where the data points are closer to the center, that would be considered better. So additionally, for our use case, we've used a weighted scoring methodology based on the importance of quality outcomes. For our case, we've determined that length of stay is the most important of these quality outcomes, so we've assigned it with the highest weight at 30%. The overall score that you see displayed is an aggregation of the scores and weights of each quality category. So we can see that product 3 has performed better than its competitors based on the overall rating, as well as their performance within the individual quality outcome categories. However, again, we want to look at the full picture here, and cost is part of that picture. So again, could be worth considering switching to a product like product 5, considering that their overall score in this scenario is close to that of product 3. The cost is substantially less than what product 3 is, and their performance within the quality outcome categories is similar, especially compared to these 3 categories of complications, length of stay, and percent of readmissions. So to add on to our analysis, and in pursuit of the quadruple aim of healthcare value that Rodolfo alluded to, we could engage surgeons to provide feedback on the products used. If there's a strong preference for product 5, for example, considering the cost and outcome factors that we've demonstrated, then switching to this product could be a smart decision for our hospital. So our analysis is a good start in order to drive our decision-making based on outcomes and value. But there's certainly other elements and metrics that could have been explored and analyzed here, including case volume, surgeon mix, revenue, and profit margin. And so that concludes the demo portion of the presentation. So I'll hand it back over to Nahul to wrap things up.
Wow, that was power-packed, guys. I really appreciated the perspective, the experience within the domain, and just the detailed understanding of really how to use data to get more insights across the board. If you guys don't mind, we do have a couple of questions. Would love to tee these up with you guys. I think, Rodolfo, you started off in the context of your experience, again, working in the healthcare domain, and just having a detailed understanding of, again, the domain and the space. Let me ask you this, Rodolfo. What would you say to an organization that wants to initiate this journey? What are some of those kind of key guiding principles or nuggets of advice that you would offer up as an organization wants to work through this journey that you just described?
Well, in terms of guiding principles, I think the very first key, I think, concept or principle is maybe is really more than a principle, is a required change in mindset, right? Is an agreement, an acknowledgement that the supply chain is a strategic asset for a healthcare organization, given the importance of supply chain for the fulfillment, right, of the healthcare mission, as I alluded to through some of my slides. So it's not just a commodity, a transactional function, right? I think the other thing is in recognizing the importance of the supply chain function, right? The strategic importance is investing in technology, right? And integration of supply chain at the point of care. I think it's another important point. And in terms of getting started, I do want to mention this without sounding like selling anything, because you don't necessarily need to do it with AVAP. But I really think that taking the assessment of the capability maturity model, HIMSS, CISOM, is a really good thing to do to start. I think that the assessment is broad and deep, covering the 4 key focus areas, which is automation, analytics, clinical integration, leadership, and governance. It helps to create consensus among leaders and key stakeholders in the organization regarding where the organization is in terms of their supply chain function, and understanding more about the capabilities of an advanced healthcare supply chain. The baseline assessment, along with the understanding of the capabilities at different levels of maturity of supply chain healthcare, can then be a starting point from which improvements can be planned and designed. I also think another important advice or recommendation is to start small with some initial key projects. Do not attempt to boil the ocean trying to create a broad value analysis program for all areas of the hospital too soon, right? Select value-based transformation use cases where there is a large variance in cost, variance in practice in regards to supplies utilization or large volume, and demonstrate financial and outcomes results through some strong use cases to show the value to the organization. Go to clinical departmental meetings to present the success stories, find new use cases, and recruit additional clinician champions for future projects. So it really takes time to change the culture. I think the challenge is really changing mindsets and making people that were not used to work this way or work together, right? Bridging the gap there.
Yeah, let me probe just a little bit deeper there, because you mentioned a couple of elements, and I'll phrase them more so in the generic people, process, technology as a part of the journey. But what are some of the most difficult obstacles that you've encountered that could potentially be barriers to progress as an organization is working through, initial capability development, and then really working through progression and maturing itself within the entire domain space here, Rodolfo?
So in all 3 dimensions, people, technology, and processes, right? I'm not suggesting it is easy. There are certainly a lot of technical and operational components that must be worked on, like the integration of your enterprise applications, ERP system, EHR system, ancillary clinical systems, right? Together, integration of operational processes and the supporting analytics. These all can be very difficult. from a design, development, and project management perspective. But I think that the most difficult aspect of these is not technical or operational, but really the cultural or organizational side. Again, it's about bringing together people with different perspectives that haven't collaborated this way before. It can be quite political, involving sensitivity and distrust, right? If this is a big change for the organization, when there is a weak understanding across the stakeholders of each other's perspective. If you think about these nurses and frontline staff are really concerned about the impact to their workflows, right, of any changes related to products, supplies, right, supply chain processes. Physicians, they care about outcomes and their experience with existing products or knowledge and opinion about new products and vendors. Supply chain cares about costs. Hospitals administrators care about efficiency. I think a strong change management process to support the transformation and the implementation of value-based analysis in supply chain process and integration with the clinical setting is crucial.
Yeah, no, that's great. That's great. I appreciate that perspective. I wanted to get into more of on the data space with this, right? You know, CJ, you've developed a demo here that's representative of the use case, but walk me through, I guess, CJ and Rodolfo, whomever has, you know, insights, and both of you probably do have insights on this, but what are some of the data requirements or data sources that should be used to, you know, source, curate, and then ultimately use to drive some meaningful analytics within the domain? And how do we ensure data quality to support these analytics use cases?
Yeah, absolutely. I can start, and then Rodolfo, feel free to jump in and add on. So just for, I guess, some context and background of that, the metrics that have really been traditionally used in this space to evaluate supply chain have been pretty confined to cost and operational components. So for example, supply expense as a % of net revenue. But metrics like these really don't give, you know, a hospital a sense of their effectiveness at improving quality and outcomes. And in fact, you know, even wrong conclusions about a hospital could be drawn just by looking at, you know, metrics that are centering around cost components. So for example, a hospital could be perceived as a high performer and achieving success, but at the expense of quality and outcomes, or kind of the other way around. A hospital that, you know, has more high costs may be considered a low performer, but they're getting that in order to, you know, achieve higher quality and thus better outcomes. So kind of setting the stage for that. But then, you know, there's new data and new ways of combining data is really required so that the effectiveness of the supply chain can be, you know, evaluated when you're thinking of improving cost, quality, and outcomes. And a lot of that's due to the heavy investment within IT infrastructure that's happened within healthcare over the last, you know, decade, with the better integration of EHR systems and being able to, you know, use data from disparate sources, including things like, you know, patient reported outcomes, patient satisfaction surveys, benchmarking, social media, you know, bringing that all together into analytic models to show that correlation between supply and impact and outcomes. There's obviously a lot that goes into this, though. It involves some pretty, you know, strong data engineering and transformation and ETL in order to, you know, perform an analysis with this data that's coming from so many different sources. But in terms of, you know, the data components themselves, a lot of hospitals have quality departments and infection control teams with curated data as they're, you know, responsible for reporting on regulatory requirements to things like, you know, adverse events, there's safety and prevention information, clinical guidelines information, benchmarks, like I mentioned, and then that quality and outcomes data. So using, you know, pieces of data associated with those categories to come up with metrics that really should be based on a clinical condition that's strongly influenced by the use of supplies. So examples of some of these metrics, you know, could be reducing surgical site infections, reducing falls and traumas, looking at medication errors, and then even things like, you know, product recalls for devices and equipment. Anything to add to that, Rodolfo?
No, I think your answer was great. Yeah, you
Okay,
covered it all.
cool.
Yeah, I've got one quick follow-up. CJ, you mentioned EHR systems, and I have to believe within just the entire healthcare space, there's some pretty mature, robust ERP and or EHR systems out there that are being used. Is, I guess, within those ecosystems, the required functionality to attack use cases within this domain, are they just not there at the moment? Or help me understand, I guess, from that perspective, because again, there's such a high investment in these ERP and EHR systems. And maybe it's just my inexperience to understand what is available to attack use cases within this domain, but help us understand that.
Yeah, yeah, absolutely. So yeah, I would say they are available for one. So let's take Epic, for example. You know, they do have functionality to help kind of manage and reduce, help reduce OR costs. They have, you know, specific reporting capabilities like reporting workbench, slicer, dicer, and radar dashboards. So you can, you know, you can do some things within the Epic infrastructure itself. But you know, this is far from comprehensive, and especially with the new approach with value and wanting to incorporate these clinical outcomes and some of the other, you know, data elements as well. That Epic simply doesn't have all that data. And so to achieve, you know, more of a robust value-based analysis, you really need that integration of the EHR and ERP systems to include, you know, data related to supply inventory, finances and financial management, and even, you know, there may be instances where having HR data could be useful as well. So, you know, that's why for us, an analytics solution like Tableau is very useful, as you can, you know, combine these disparate data sources and data sets onto a single platform. And I would also say that the customization, the interactivity within Tableau really set it apart. It's got a great user experience, a ton of variability in the charts and visualizations that can be created that, you know, based on my personal experience, far outweighs what you could accomplish within an EHR. So with the example we gave today of the radar chart, you know, that's definitely something that, from my knowledge and experience, you would not be able to build out in one of these EHR systems. So yeah, and then, you know, also just I think of processing too, the efficiencies of processing, and Tableau is great with that. You know, again, from my personal experience working at a medical center, kind of comparing my use cases in Tableau to pulling data and reports in Epic, it definitely took a lot longer to get that data in Epic just to run their versions of reporting and visualizations compared to what you can do in Tableau by you know, creating extracts of data, refreshing those, you know, on outside of normal business hours, and being able to view that data in seconds compared to, you know, the minutes it would take me to view it in Epic. And then the last thing I'd say too is there is some kind of cross-functional integration available between Epic and Tableau. You're actually able to, at this point, embed Tableau dashboards into Epic, you know, which provides direct access for users to get to those dashboards within their, you know, normal day-to-day workflows.
Yeah, no, I appreciate the insights there. And I guess a follow-up to that, I have to imagine that as we talk about these large systems and potentially even some more ancillary disparate systems that can help support downstream use cases within the domain, the element of data stewardship and even the tactical nature of data governance in the context of making sure that data elements are consistently defined and used across all parties in a consistent manner is incredibly imperative as we start talking about, again, downstream analytics, the use of that data in a curated manner to support metrics and metrics understanding. Walk me through, I guess, some of the journey from the people side to get, you know, consensus on the data terminology to help support this use case.
Yeah, Rodolfo, do you have some thoughts on that one?
Sure. So obviously that this is not limited to supply chain, clinical integration, but I think absolutely data governance is an enabler. I would say a necessity to really produce high quality data and analytics. I think what is really difficult is agreeing on the meaning of data, right? So because we are here looking at selecting a whole new set of metrics to measure, define value, right? So these are new concepts that have to be worked through, right? And you need a consensus on the meaning, the impact, how it's going to be used, right? Context. So I think a information stewardship process that works through creating these standard set of metrics, definitions, and terminology. So to really promote the development of a common language around value, right, in the supply chain in this specific space, but it's applicable to any other area where data is being leveraged for decision support, right, and analysis.
Rodolfo Ropel, CJ Martin, you two are of the best in the context of this domain, your experiences, your perspectives, your insights, and your education for all of us. Thank you so much for the time today. Loved understanding, again, from a high level and then more depth from a demo perspective. Thank you all for putting this together. We appreciate your time. Thank you so much and have a great day.
Thank you.
Thank you.